Thanksgiving or whatever, and it's still doing that now up to now. 9:16 Wednesday, August 18th. Good morning. Let's head into the KUAM News Zoom room where we have Leilani Navarro of the Department of Public Health and Social Services. She oversees the Division of Environmental Health, as well as she's the acting Environmental Public Health Officer. I'm surprised you don't have two heads, Lonnie, since you're wearing so many hats.
Well, actually, I'm the acting administrator for the Bureau of Inspection Enforcement. Our chief is still Tom Nadeau, so he's actually back to his office from a court trial. So he's there. He's still the head.
Right on. Why did I just promote you by accident?
I think you did.
Tom's like, I got to call the director. What happened? I didn't get the memo. But, I asked Director Art to get you on because, correct me if I'm wrong, God, I hope I'm right. You guys are responsible for enforcing the mask mandate?
Yes, we are. Since the start of the pandemic, we've been assigned to enforce the governor's executive orders to prevent the spread of COVID-19, as well as any public health guidance memo that comes out in relation to that executive order.
Okay, so do you know how many tickets you guys have actually issued for the mask mandate? And I know you have cited some people as a result of just COVID inspections you did at some establishments over the last year, right?
So are you asking since the start of the pandemic or just for this recent executive order when we reached the 80% vaccination rate?
How about both?
Sure.
I think we... Yeah. Unmute.
Oh, I'm sorry.
No worries.
Okay.
Yeah.
So let me start with the current executive order, which requires that everyone wears masks unless they're exempted, such as when they have medical conditions. So far, the executive order and our guidance memo, which came out in July 29th, we have not cited anyone. Meaning, although we have received complaints and have acted upon complaints of people not wearing their mask, when our inspectors go to that facility, the complaint was not observed. Everyone were wearing their masks properly, and they were abiding by the current guidance memo. But since the start of the pandemic, in my file.
I think we need to have Jason take a look at your laptop.
Okay, I think so since February 19 up to June, which is the current data that we have, actually July 26, 2021, which is the data that we got from the Traffic Violation Bureau, which compiles all the citation tickets that we've issued. We have 17 violations. So these range from not following the social distancing mandates, congregating, not wearing face masks. So this is a mix of everything that were, all the restrictions that were in place since the pandemic started.
Is that February 19th as in 2020 or 2021?
I'm sorry, 2021. Okay, my apologies. The only data that I have actually starts February 18, 2021.
to July 2021. current.
July 6, 2021. So there's 17 citation tickets that were issued.
Leilani, can you give us the dollar amount associated with these citations? Not necessarily what was paid, but the fines that come with these 17.
Sure. So if it's a business, if it's the first violation, it starts at 1,000. So but usually it's only business that we've cited, not individuals. So it's 1,000 per violation. And then for succeeding violations, it goes up to 5,000.
Does GPD report the citations that they issue to public health?
They actually reported to the Traffic Violation Bureau.
I see.
So there's nothing here on my record that shows GPD issuing officers. So these are all DPHSS employees. So I can go ahead and ask Ms. Roberto of the TVB, who is the TVB clerk that gives us this information.
And these tickets that are issued, is this just from when someone calls in and makes a complaint, or?
So previously because of staffing challenges, we've only been able to respond based on the complaints that we received. But since the 80% have been vaccination rate have been reached, we've been tasked to do spot checks. So on a daily basis, there's 1 to 4 inspectors that go out and checks these establishments that are populated, or if we hear of any event or gathering. So we just want to make sure that we're there and we're reminding people to wear their mask properly and wash their hands and make sure that the surfaces are cleaned and disinfected. And if it's required, they need to maintain the contact logs. So this is a requirement for all eating and drinking establishments, for schools, for childcare facilities, and cosmetology establishments.
Did you guys ever receive any complaints or concerns? We had the chief of police on, and he was talking about down in Tumon, a lot of people going around with masks, and that I believe he was saying some hotel workers had some issues with trying to get people to wear masks in the lobby. Was this just something that GPD took care of on the scene, or were you guys activated to go down and issue any citations?
Well, we were actually called 2 consecutive weekends until Sunday, just this Sunday, because we received complaints that indeed in the hotels, people were not wearing their masks properly. So our team went out. We scouted all the hotels in Tumon. We also did inspections of GPO food court and the mall itself. However, all the places that our inspectors went to, everyone was wearing their masks. So no citations were issued.
So basically what happens is someone's not wearing the mask right or whatever, and then the staff will say, hey, can you put that on? And they put it on, and when you guys show up, everything's okay.
Yes.
That's good.
Yes, that's right. Of course, our aim is really to educate and work with everyone to ask for their cooperation in ensuring that they're following the mandates, the executive orders.
Does your division also approve, like if somebody wants to have a ball, for example, do you guys have to approve their plans on how to ensure that they, contain or prevent the spread of COVID?
Sabrina, you're talking about if someone has an event?
Yes. Does it have to be approved by your division?
Yeah, so we used to do that. However, after the issuance of DPHSS Guidance Memo 2021-18, which does not require any facility to submit mitigation plans except for schools. So we have not received any a mitigation proposal for a special event because it's not required.
Wow.
But we are the only requirement is for the schools to submit an in-class operating plan.
Lonnie?
So basically, if I want to go and have a huge birthday party or fundraiser for 200 people in a ballroom, I could just do what I want, right? Just as long as everybody's wearing a mask.
Correct.
Okay.
Because most of the restrictions have been lifted,
Right.
so there's no more social distancing requirements or occupancy limits in any event. So yeah, they can do that as long as they wear their mask properly. They have adequate hand washing facilities, and they're able to clean and disinfect the facility on a frequent basis.
So
it's party times. Wide open, guys. Wide open. I mean,
clearly, if you see the numbers, right?
we're in a surge. Do what you do.
But that's why we are trying to go out as much as we can to check and ensure that everyone is at least wearing the mask properly.
What's the protocol right now, Lonnie, with business establishments? Like, what do they have to have in place right now? Temperature checks? What's the protocol?
No, that's actually, that's never been a requirement. The only requirement right now is, first and most importantly, is that everyone wears a mask except when they're eating, drinking, or actively engaged in physical activity, or they have a medical issue. This is in keeping with the CDC recommendation for the wearing of masks. Also, they need to have to provide adequate hand washing facilities for their employees and for the customers. Third, they need to maintain contact logs, which is a requirement for 4 types of facilities, which are the eating and drinking establishments, the schools, childcare facilities, and the cosmetology establishments, which are the beauty salons and barber shops. And then the fourth one is they have to have a policy in place, and they're able to implement frequent cleaning and disinfection of their establishment. So those are the 4 requirements as of the current guidance memo.
And if I walk into an establishment and they're not doing that, call public health or call 311
Yes,
or call.
Yeah. What is the number?
Yes, they can call 311, and 311 will forward the complaint to us, and we will address it right away, because that's our COVID mitigation is our priority right now.
All right, thank you so
All
much.
right, Lonnie.
You're very welcome.
Right on.
So, okay.
I saw
You guys
the
have a good
inspection
day.
reports. It looks like everybody's following the guidelines. No, I didn't see any citations or anything.
That's right.
Well, there's no guidelines though. Oh no,
I'm
just
talking
kidding.
about
Yeah,
her,
yeah,
the one.
the COVID.
Yeah.
Lonnie, I wanted to ask though. So we talk about one of the requirements is that these certain types of businesses have to keep the log, right, of who comes.
Correct.
But we had Chima on, and he was saying that they were trying to contact trace a bar, and the owner of the bar didn't want to say or show the contact tracers the log because I guess people had their chakma there or whatever. So do you come across that kind of thing a lot, or?
Not currently, but we've been actually starting last night. We've been going out and checking the bars again. So we'll definitely be educating the bar operators, to make sure that they have these logs.
Well, it's not just having them; it's also them showing it to you guys. right? And being in
Yes,
compliance.
the requirement is actually they have to maintain the contact logs for 30 days.
So what happens in the event of this, like the men's karaoke bar where they were doing the contact tracing and the owner was uncooperative? Is there like a fine associated with that kind of thing?
Yes, there will be a fine available. So, but of course we would have to verify the what actually happened.
Well, I mean,
Our inspectors have to see like if indeed they don't have the logs, and if they do, they need to show it to public health.
Okay. Thank you, Lonnie.
Thank you.
You're welcome.
Stay safe.
Bye.
We'll see you. Take it easy.
You too.
Appreciate your hard work. 9:31. Let's keep it in the KWAM News Zoom room where he's back from leave.
Great virtual